1 in 6 couple across the globe is facing with this issue, and it is a very common thing. So here we need to understand what the causes are, what can be done about it, and what are the options that you have to conceive a child. The most common questions that couples have is what is infertility and what are its causes. So here we need to understand what infertility is. So according to WHO, which is the World Health Organization, it is defined as the inability of a couple to conceive after 12 months of unprotected intercourse. So all these criteria have to be met. It has to be for 12 months and it has to be an unprotected sexual intercourse. So you don't have to run to a gynecologist after 6 months saying that you are infertile. Or you shouldn't be waiting for 5 years thinking that everything will be okay with time. So this is what is the most important thing here. And what are the things and what are the causes here? So 1 in 6 couple across the globe is facing with this issue, and it is a very common thing. So here we need to understand what the causes are, what can be done about it, and what are the options that you have to conceive a child. The thing first that we will be discussing here is what are the causes. So the causes could be related to your female partner, it could be related to your male partner, it could be because of a condition that is there in both of them, and there is something called as unexplained infertility, which attributes to around 30 to 40% of the causes. So coming to the female partner. So what are the issues that could be there in the female partner? So it could be starting from anything related to your uterus, your ovaries, your tubes. Even having sexual intercourse is a very important thing before you consider being infertile. So all these are certain things that you need to keep in mind, and then there are certain things which are above this also, which could be related to your general systemic problems, or which could be something related to your nervous system also, which releases hormones. So this is something regarding your female partner. Now coming to your male partner, what could be the issues with your male partner? So what we need to understand here is females and males, they both play equal role in fertilization or in having a baby. So it is not just a problem with the females, it could be something related to the male also. So as a normal thing or a normal investigation, the basic thing that we need to do is a semen analysis of your male partner to see if everything is okay. Now coming to unexplained infertility. Now what do you mean by unexplained infertility? Unexplained infertility is something that we diagnose after doing a battery of tests and then realizing that there is no issue with the female or the male, but still the couple have problem in conceiving. And all these factors together cause infertility, which has to be understood by an infertility specialist who will do all these tests on you and will be able to help you in guiding better towards your conception. So what are the treatment options you have once you are infertile? So you go to a lot of places. You need to understand what has to be done. So you need to seek somebody who will make you understand where exactly the problem is and what is the best way to reach the final point, that is a conception. So it is not just about spending a lot of money or like doing multiple cycles of IVF. What somebody needs to understand is whether IVF really required, or is it really something that has to do with an easier treatment option also, like an IUI, or like something that can be dealt with in a better and an easier way. So that is where everything changes, because this involves a lot of money, a lot of time, psychological, financial and social stress. So what we need to understand more here is the cause of infertility and also the factors which are very important in this. The most important being the age and the age of your female partner. So the treatment that is done on a 25-year-old might not be the treatment that we offer to a 35-year-old. So those are the things that changes as your age changes. It also depends on the number of years that you're married. So if you're married for 2 years and 10 years makes a world of difference in the treatment modalities. So these things have to be understood by the treating physician and by you, so that you can have a combined effort in your treatment plan. So these treatment options will help you guide better. So I will be doing another video on what are the various treatment options that you have for planning your pregnancy. Thank you.